Recent findings from the international ProPASS Consortium reveal that replacing sedentary time with 20 to 27 minutes of daily moderate exercise can reduce the risk of cardiovascular disease by up to 28%, underscoring the significant health benefits of increased physical activity. Additionally, new research highlights that even small additions to daily routines, such as uphill walking or stair climbing, can contribute to lower blood pressure. This study, published in the journal Circulation, was conducted by the ProPASS, Prospective Physical Activity, Sitting and Sleep Consortium, an international research collaboration led by the University of Sydney and University College London, UCL. The findings indicate that as little as 5 minutes of daily physical activity could help reduce blood pressure. Replacing sedentary time with 20 to 27 minutes of exercise, such as uphill walking, stair climbing, running, or cycling, was associated with clinically significant reductions in blood pressure.
Professor Emmanuel Stamatakis, joint senior author of the study and director of the ProPASS Consortium at the Charles Perkins Center, commented, "High blood pressure is a major global health issue, but unlike some leading causes of cardiovascular mortality, it may be managed with relatively accessible lifestyle changes alongside medication." He added, "The fact that just 5 additional minutes of exercise per day could lead to measurable reductions in blood pressure highlights the powerful impact that even short bursts of higher intensity movement can have on managing blood pressure."
Hypertension, or persistently high blood pressure, is a leading cause of premature death worldwide. Affecting 1.28 billion adults globally, it is a major risk factor for stroke, heart attack, heart failure, kidney damage, and other serious health conditions. Often called the silent killer due to its lack of obvious symptoms, hypertension remains a critical public health concern. To investigate how different types of physical activity impact blood pressure, the research team analyzed health data from 14,761 participants across 5 countries. Each volunteer wore a thigh-mounted accelerometer, which monitored their movement and blood pressure continuously throughout the day and night. Daily activities were categorized into 6 types: sleep, sedentary behavior like sitting, slow walking, fast walking, standing, and vigorous exercise, such as running, cycling, or stair climbing. The researchers used statistical modeling to estimate the impact on blood pressure if an individual replaced various amounts of one type of activity with another. Their findings suggest that replacing sedentary behavior with 20 to 27 minutes of daily exercise could potentially reduce cardiovascular disease risk by up to 28% at the population level.
Dr. Joe Blodgett, the study's first author from UCL's Division of Surgery and Interventional Science and the Institute of Sport, Exercise and Health, explained, "Our findings suggest that exercise, rather than less intense activities like walking, is most effective for reducing blood pressure." The encouraging news is that positive effects on blood pressure can be achieved quickly, regardless of physical ability. Our exercise metric is unique in that it includes a wide range of everyday activities, from running to catch a bus to a quick cycling trip, making it easy to incorporate into daily routines. Dr. Blodgett added, "For those who engage in minimal exercise, walking still provides some benefits for blood pressure. However, for meaningful blood pressure reduction, activities that place greater demand on the cardiovascular system will be most impactful." Professor Mark Hamer, joint senior author of the study and ProPASS deputy director at UCL, stated, "Our findings demonstrate the value of research platforms like the ProPASS Consortium in uncovering subtle patterns in exercise, sleep, and sedentary behavior that carry significant implications for clinical and public health."